Hey there, viewers. Have you heard of leukopenia? Neither have I. Either way, it's something to be concerned about. Leukopenia is a decrease in leukocytes. These are the white blood cells, your body's main defense against infection. While there are many types of leukopenia with various symptoms, there are specific factors that cause a drop in cells. Do autoimmune disorders contribute? How about a lack of vitamins and minerals? What about treatments for things like cancer? Let's discuss 8 causes of leukopenia that you should be cautious of. Number 1, radiation. This one is a little more extreme, but I was going to bring it up either way, so buckle in. Radiation therapy can cause a drop in white blood cells. If you're suffering from diseases like cancer, you may receive radiation treatment or chemotherapy. While we undergo these treatments for good reason, the side effects are endless. These practices can generally affect your body's cells, your white blood cells being among the particles that take the roughest beatings. This triggers a type of leukopenia known as neutropenia. Neutropenia describes a specific drop in neutrophil granulocytes. These are your most abundant white blood cells. During treatment, medical professionals make it a priority to check your white blood cell count periodically. This is how they stay on top of your body's current state. A normal white blood cell count is usually between 4.5 thousand and 11.1 thousand per cubic milliliter. If your doctor sees your count is at less than 1,000, you're at serious risk for infection. Since losing white blood cells during the therapy is normal, there really isn't a way to prevent it from happening. What's more important is that once your count drops, you're taking proper precautions to not become infected. Healthcare workers will normally outline some of them. These precautions include washing your hands frequently, using mouthwash, and avoiding people as often as possible, especially those who are ill. Number 2, anemia. I'm just throwing all these fancy conditions your way, aren't I? To be honest, we had to read up on some of them ourselves. Anemia is a condition where your body lacks the proper number of red blood cells. As it turns out, your white blood cells can also suffer a devastating hit. While further testing does need to be conducted, studies have confirmed a link between leukopenia and patients with anemia. In one particular study, the records of patients with iron deficiency anemia were examined. The information of 516 people was collected. Out of those, leukopenia was found in 91% of the patients. The leukopenia found in anemia patients is closely associated with a decrease in hemoglobin. These are the red blood cells that carry oxygen to the body's tissues and organs. The next time you're at the doctor, ask them about anemia and how it can specifically affect your blood. Do you find this video interesting so far? Don't forget to subscribe to our channel, hit the like button, and ring the notification bell to stay up to date on all of our great bestie content. Number 3, tuberculosis. Patients suffering from this awful disease are known to have smaller white blood cell counts. Let's talk about the details. Tuberculosis, or TB for short, is a sickness that affects your lungs. It's caused by slow-growing bacteria that accumulates in areas of your body which carry blood and oxygen. While the number of TB cases in recent years has certainly gone down, it's still terrifying for those who must experience it. Patients who undergo anti-tuberculosis treatment often experience leukopenia as a side effect. A 2015 study was conducted on people with TB. It highlighted just how significant the correlation was between the treatment and the loss of white blood cells. Researchers discovered multiple factors including gender, vegetable consumption, use of antibiotics, drinking, and pulmonary infection. These all played a role in the severity of the leukopenia. Female patients are particularly vulnerable to this condition, especially those in an advanced age. If you're suffering from TB and have a low count of white blood cells, it's important to increase your vegetable intake and avoid drinking alcohol. You should also pay attention to the use of your antibiotics and treatment. This is yet another thing to discuss with a medical professional. Number 4, malnutrition. I hope you've been getting your vitamins and minerals, because guess what? A vitamin deficiency can bring on leukopenia as well. Malnutrition is another leading contributor in white blood cell deficiency. This can occur when your body is missing out on vitamin B12. When it comes to maintaining your health, proper consumption of B12 is crucial. It increases your energy, helps improve your cognitive functioning, and supports the health of your bones. It also plays a role in the growth of cells. Vitamin B12 deficiency has been linked with a loss of white blood cells. To increase your B12 content, start eating more meats like beef, liver, and chicken. Eggs are also useful. Don't forget other dairy items such as low-fat milk, cheese, and yogurt. Basically, anything that comes from the farm has the power to assist you. Other nutrient deficiencies associated with leukopenia include folate, zinc, and copper. Before we continue, have you been feeling lonely in quarantine? Check out our recent video discussing 6 ways to beat your loneliness. Now, let's continue our discussion of 8 causes of leukopenia you need to watch out for. Number 5, medication. If you're currently taking medication, your chances of leukopenia are heightened. A common side effect of medical prescriptions is a drop in white blood cells. I talked earlier about the dangers of radiation treatment. These treatments, on the other hand, are normally ones you take from the comfort of your own home. I mean, anything from anti-thyroid medications, anti-metabolites, and chemotherapy drugs. Antipsychotic medications, such as clozapine, have also been associated with leukopenia. If you're trying to get over your smoking addiction, watch out. The medication bupropion has also been noted for its contribution to the deficiency. Epileptic patients and those with depression are also vulnerable to a drop in white blood cells. If you're currently on medication or are about to be, make sure you discuss with the doctor the dangers they may pose to your white blood cells. Number 6. Bone marrow disease. If you're suffering from a type of bone marrow disease, your white blood cells will be affected. But what exactly is bone marrow? You've had to have heard of it. Bone marrow is the tissue found inside bones like the hip or thigh. It's here that white blood cells are meant to flourish. If the vessel that houses them is being threatened by an outside agent, the cells will begin to die off. Diseases that affect your bone marrow vary from leukemia, aplastic anemia, and lymphoma. With leukemia, your bone marrow will begin to produce abnormal white blood cells. When lymphoma enters the bone marrow, the rate at which your blood cells produce become disrupted. Over time, fewer and fewer white blood cells exist. There are some diseases that enter the bone marrow that have the exact opposite effect. In those cases, too many white blood cells are produced. Either way, you want a normal count. Number 7. Arthritis. Rheumatoid arthritis is yet another condition that seems to invite leukopenia. Just to clear things up, this describes a chronic inflammatory disorder that affects your joints and more. When this happens, your body's tissues are damaged. This is what leads to something like Felty's syndrome. Sounds kind of goofy, right? It's not. Felty's syndrome is a type of rheumatoid arthritis where leukopenia takes place. As it progresses, your leukocytes are unable to properly function, which causes them to decrease. Keep in mind that rheumatoid arthritis can also cause the opposite reaction. There are times that arthritis patients have blood tests conducted and a doctor notices a shockingly high amount of white blood cells. This is due to the inflammation that's occurring in your joints. In this case, your leukocytes have increased in quantity as a way to combat the infection. Number 8. Sarcoidosis. Here's another one you're probably unfamiliar with. To be fair again, so was I. Sarcoidosis is another name given to an exaggerated immune response. When this happens, small areas of your body will become inflamed. It's basically the response your body answers with when your immune system overreacts. In certain cases, sarcoidosis will hit areas like your spleen and bone marrow. From here, a number of reactions occur. If this immune response touches your bone marrow, it can lead to leukopenia. Your white blood cell count will decrease, leaving you open to several different infections. Do you feel like you have a low blood count? Are you lacking in vitamins and minerals? Are there any treatments you're currently taking? Let us know in the comments below. We love to hear from you.
Enjoyed this video? Hit like, share, and subscribe to Bestie. Wait! What kind of bestie would we be if we didn't tell you about our other awesome videos? Go ahead, choose the left or right video and enjoy.